to Straight from the Gavel. I'm your host, Dave Barber, coming to you today from the historic lounge of the Rhode Island House of Representatives. In this segment, each and every week, we like to invite a member of the General Assembly in and discuss many of the things they've been working on and how it might impact all of us here in the Ocean State. And it gives me a great deal of pleasure to welcome a woman making her very first visit to Straight from the Gavel, and we're delighted to have her from the City of Providence, Representative Maria Cimini. Representative, it's great to see you.
Thank you so much for having me today.
Well, it's good to have you because we always like to get new people in on the show, and since it is your debut performance here on the telecast, why don't you tell our viewers a little bit about yourself? Give us a little background, both personally and professionally.
Sure. So I am a third-generation Rhode Islander. I grew up in Cranston, where my parents still live, and many years ago moved to Providence, where I now live in Elmhurst. And I am a first-term representative representing the Mount Pleasant, Elmhurst, and Valley sections of Providence. I always say it's kind of bookended by the Veterans Hospital and Rhode Island College. It's that area in there for people who don't know the neighborhood names. I went to Rhode Island College and did an undergraduate degree in political science and a master's degree in social work, and have always been involved in politics. I'm the first person in my family to run for office, but when I was about 5 years old, I went door to door for city council candidates with my dad, slipping little notepads to vote for Nick Ferranti in people's doors. My parents always had political science on their lawns, and my mom loved to vote more than anything else in the world. We grew up across the street from a polling place, and my mother took great pride in being the #1 voter for every election. So I was just raised in a family that saw government as a way that you could contribute to your community and give back to your community, and that's what I'm doing now. I'm here at the State House making some laws and trying to make Rhode Island a better place.
And when you're away from this building, you work in social services, correct?
That's true, yes. I work at the University of Rhode Island for an academic center called the Feinstein Center for a Hunger-Free America. And there I coordinate the SNAP outreach campaign for the state. So SNAP is the Supplemental Nutrition Assistance Program. It's the new name for the program that most people know as food stamps.
Right.
I've been doing that for almost 8 years now, and my day-to-day job is to go out into the community and talk to low-income people to help them to navigate through a kind of confusing process, a bureaucratic process of being eligible for nutrition assistance.
Well, obviously, as a result of that, might I say, noble work, you get to see up close and personal the ravages of poverty in our state. Nobody has to explain it to you. I would guess that you have a pretty good feeling for what folks are going through right now that are having tough times.
Yeah, I think I do. I mean, every day I talk to people, young families that are struggling, retired folks, people who've worked their whole lives, veterans, people who have disabilities, people who are just trying to make ends meet. And they're struggling to do so. We know that food prices are on the rise, that gas prices are on the rise, home heating oil prices are on the rise, rent is on the rise, and wages haven't kept up with that rise. So many people who I work with every day are employed. Sometimes they have multiple jobs, and they just still can't make it. And fortunately, there's this federal program that says that if you live below 185% of the federal poverty level, then you may be eligible to receive this nutrition assistance to buy some food, a most basic need for the people in your household.
Now, tell me about this experience you had with something called the Food Stamp Challenge.
Yes.
This was something that you personally participated in. I'm not totally familiar with this. Explain it, please.
Sure. So several years ago, I believe it started in Pennsylvania, that some anti-hunger advocates approached their congressional delegation and said, we would like you to live for a week on the average food stamp allotment, just to see what it's like. So this past fall in Rhode Island, 80 Rhode Islanders, including Lieutenant Governor Roberts and many members of the faith community, participated in this. And so I spent a week living on $31.50 worth of food.
Wait a minute. $31.50
yes,
for the whole week?
For the whole week.
7 days.
Yes, it averages out to $1.50 a meal. And so I made a shopping list. I went grocery shopping. I actually went to a couple of different grocery stores to get the best sale so I could have enough money to eat some food. I mean, certainly you can certainly eat at $31.50 a week, but do you eat well? Not so much. And so I planned out my meals, I planned out my week's worth of shopping, and it was really a fascinating experience because, as I said, I've done this work for 8 years, and so I really kind of boldly felt like I knew the lives of low-income people.
Sure.
But to actually have to make those decisions about whether or not I buy fresh broccoli or frozen broccoli, because one is cheaper than the other, whether or not I buy fruit or coffee, and I'll tell you, I chose coffee. It wasn't the best nutritional decision,
Right.
but it was the best for me. And to make those kinds of decisions for yourself and see what the struggles are.
You know, it's very interesting to hear that story because $31.50, I don't know why I just conjured up in my mind that the average would be higher than that. But it's a testament, too, to people that are on this type of assistance program. They're not living in the lap of luxury. And
They certainly are not.
so often the haves of any community like to stereotype people that are on some sort of state or local assistance program as taking advantage or living high on the hog.
I know.
And they characterize them something quite differently. And boy, I'll tell you what, that would be a tough assignment for anyone at $31.50 for a week.
It absolutely was. And you know, just to expand on that a little bit, one of my pet peeves is the misconception about people who receive cash assistance or welfare, as it's traditionally known. And in Rhode Island, if you're a household of 3, that could be a mom and 2 kids or 2 parents and a child, you get $554 a month in cash assistance. And from that, you pay all of your bills. And I would challenge anyone with 2 children to support them on $554 a month. And it's time limited, so you can't be on for more than 48 months in your lifetime. So there's a lot of misconception about these programs.
Well, and again, we have people watching this telecast right now. Maybe never in their wildest dreams did they ever envision their family of being in a situation where they would need some help like this. Not a handout, but a hand up.
Right.
And this economy has been so bad for so long, it has been protracted out so long, that there are a lot of people that are suddenly receiving these types of
Yes.
benefits that are completely, you know, and there's a stigma that's associated with it that's unfortunate.
Without a doubt, there's a stigma to receiving these benefits. And you're absolutely right. I talked to many people who had jobs, had good paying jobs 1 or 2 years ago, and they've spent down their savings and they haven't been able to get back on their feet. And they're now turning to us with shame in their eyes about having to ask for this assistance. And I really try to stress with them, you know, you pay taxes, you contribute to your government. And in the same way that a plow comes down and plows out my street when it snows, I don't need to shovel out my street because my tax dollars cover that.
Yeah.
Your tax dollars pay for these programs for when you're in a tough spot. And that's why I try to let people know.
When we talk about the SNAP program, somebody watching right now that maybe themselves or a family member or neighbor or friend that's in a tough spot, where is a starting point? Where can you channel these people that think, hey, you know, I've been out of work a long time, maybe my unemployment's run out.
Right.
Are there some programs that I might qualify for? Is there a clearinghouse? Is there a place where you can direct some people that are watching right now?
Well, Dave, I'd actually direct people to 2 places. One is, of course, the Department of Human Services. It's the state agency that's charged with doing this. And they have an information line. That phone number is 462-5300. And, but for someone who might need a little bit more help or someone who might just have some basic questions that they want to ask before they figure out if they want to pursue this, we have a SNAP hotline, and that number is 1-866-306-0270, or you can go online to eatbettertoday.com, and you can find a lot of answers to the questions that people frequently have as they're entering this world.
You know, and I'm so glad you mentioned what you did about that stigma, because there but for the grace of God go I.
Absolutely.
And you know, people say, oh, there are so many of these people that are taking advantage of the system and mooching off the system. Wait a minute. These men and women for many years, paid taxes into the system.
Very true.
And even if you're on state assistance, you're still paying taxes into the system.
You are still paying taxes into the
As a
system.
result of this situation that you're in. And even people that rent, you know, the misnomer is a portion of their rent that their landlord is paying is going to property taxes
Without
for that
question.
property. And so I think, you know, oftentimes the least among us, they don't have a professional lobbyist, you know, that can come here and chat with you folks. And, you know, a lot of it just comes from grassroots activism. So again, I'm so glad that you talked about these things. You had, you know, you mentioned that you're a freshman, but you had a pretty big victory during the budget debate.
I did.
Tell our people, our viewers, about your proposal which adjusted the work requirement for our state's quote-unquote welfare program.
Thank you. So, well, welfare in Rhode Island is known as Rhode Island Works, and there is a work requirement to participating in cash assistance in Rhode Island. And I think that that's important. I think that the time that one spends on cash assistance is a time to develop good work skills, and because as we know, we need a strong, robust workforce for our state to be successful. However, when one went in to apply for Rhode Island Works, the first thing they had to do was to go to work. Oftentimes, the people who are applying for Rhode Island Works are not at a place that they're able to go to work immediately. There may be a disability, there may be that they haven't met certain learning achievements or learning goals. And so what this legislation did, or the portion of the budget that passed did, was say when you go in to apply for Rhode Island Works, rather than the first thing you do is go out and try to find a job, there'll be an assessment period first. And perhaps your first step would be going to a training program so that you're then able to get a job. Because as we all know, jobs are scarce, and if you have low skills, they're even scarcer. And so giving people the opportunity to gain some skills so that when they do find employment, it's successful and enduring employment, that's the goal of that piece of legislation.
Well, and not to mention that there aren't a whole heck of a lot of jobs out there to begin with.
Unfortunately, no.
I was watching something on a network news broadcast this weekend. A lot of folks with four-year degrees and advanced degrees that can't find work.
Yes.
And some of those people with master's degrees are taking like entry-level positions at certain companies in order to get by. You know, the other thing that I think is maybe a catch-22 with this whole Rhode Island Works concept, most people really want to give an honest day's work for an honest day's pay.
It's true.
I don't think we're going to get much of an argument about that. The problem becomes childcare.
Yes.
Because a man or woman that wants to go out and be gainfully employed, they then have to get someone or a daycare place. And when I talk to some of the parents around this building, and I hear some of the costs of childcare, I was shocked. I had no idea it was that expensive.
Blows your mind.
So how do they balance that? They want to go to work, but if they go to work, are they going to be able to make enough money to provide for childcare? So
the childcare conundrum is really great because people do want to go to work and they want to earn a paycheck, but they want their children to be in a safe place while they do it. And so there are two ways that there are bills in the legislature right now to address those childcare issues. Currently, if you live in Rhode Island and your income is, I believe, below 170% of the federal poverty level, it could be 180.
Okay.
But if your income is in that range, you're eligible for subsidized childcare. So you still pay. You pay a percentage of your income towards childcare, but not fair market value. And currently, you can get childcare during the hours that you're working. I have a piece of legislation that says that if you work at least 20 hours a week, but you're also in an education or training program, you're able to get childcare during those hours that you're in education and training as well. So that a parent who might work at a fast food restaurant or a convenience store could, if they're also in school trying to gain their skills, they can make sure their children are in a safe place at the same time.
You know, many states have gotten into this trick bag where folks that are receiving assistance say, hey, I can't afford to go get a job because I'm going to have to sacrifice my children, the child care, and it works against getting people to be productive. So are you optimistic about this legislation to provide this extended protection for these families?
Well, I, of course, think it's a great piece of legislation. It does have a fiscal component to it, and in these economic times, that's a tough sell. But I do know that there are legislators who are excited about it and are interested in voting for it should it move out of committee and come to the floor. So I'm keeping my hopes high, but sensible at the same time.
Well, listen, you're on the right side of the issue.
I do believe so.
Because, the Supreme Architect said we'll be judged by the way we do indeed treat the least among us. And if we don't make it reasonable for people to want to go out and get the skills and the training to become gainfully employed, we're going to be in this vicious circle and never find our way out.
It's so true.
And so I wish you good luck with that.
Thank you.
You say there is a fiscal component. Well, here's an idea that you had. Let's just tax Rhode Island rich people more.
So that is a bill I've introduced. And the way that the legislation works is it says that currently, the way the legislation works, is to say that if you make $250,000 a year, rather than paying the 5.9% income tax that you pay to the state of Rhode Island, your tax rate would be increased to 9.9. Now, a lot of people say that that's unreasonable, that that's too high. But I think that what the beauty of the legislation is, though, is that it's tied to our unemployment rate. There's no denying the fact that we have an incredibly high unemployment rate in Rhode Island. And when there's high unemployment, there's reduced revenue from taxes. And so during this period that we are struggling as a state, and again, I don't think there's any debate about the fact that we are in a financial crisis.
No question.
The taxes would increase for those wealthiest Rhode Islanders. But as the unemployment rate decreases, the tax rate will decrease as well. So if we're at 10.3% unemployment right now, when we're at 9.3%, that 9.9 tax rate will be reduced to 8.9. So it's saying for this time that we are in need, we're asking those people who still have some resources to step up and fill that need a little bit, because the state has an obligation to provide certain services to its members, to its community. And right now we're struggling to do that. And I know for many years we've been struggling to do that. And we've addressed most of those struggles by cutting programs. And I happen to believe there's not a lot left to cut.
Every national survey I see that's independent says the American public says rich people should pay more in taxes.
Yes.
You have Bill Gates and Warren Buffett saying we should pay more. They're just announcing that.
Yes.
That we should pay more. Obviously, these programs that you talked with earlier during this broadcast, yeah, they have to be paid for. How many people wouldn't take $250K and say I'll gladly pay 9.9%?
Well, there are some who have said that they don't want to do that.
But wait a minute. If you're not in that position right now,
right.
Yeah, there are the majority of people watching right now do not make $250,000 a year.
No.
That 1% in the United States of America, they've done pretty good the last decade.
They absolutely have. I can't quote the studies, but I know I've read recently that, in fact, over the last decade, that 1% has seen their income grow at rates well beyond the growth of wealth of the other 99% of Americans.
Well. So you have it tied to the unemployment figures. So it would be a sliding scale.
Yes. Yeah.
What are your colleagues on the House floor saying? What kind of support are you getting from the men and women you serve with?
Well, I have to say I'm overjoyed. There are 37 of us who've signed on to this piece of legislation, and a few others who said, I wish I had gotten my name on that. I'm happy to vote for it when it comes to the floor. So I think that there's a lot of interest in this. I think that it both addresses an immediate need, but also isn't punitive in the long term. I'm not just saying you've been financially successful, you need to pay more. I'm saying you've been financially successful, our state is in crisis, we need you to step up at this time because the rest of us cannot. And then once the state turns around, then you won't have to pay as much in the future.
And we learned something about this trickle-down economics business. I hate to break it to the viewers. It never trickled down.
That's what I've heard.
it never trickled down.
Right.
And the fat cats and the 1% just got fatter.
Yes.
Even in these tough times. Now, at the risk of taking on a Rush Limbaugh topic here.
Oh, yes.
You also have been active with legislation that would provide Medicaid coverage for family planning.
Yes.
That's an important topic. And obviously, especially women in healthcare have been in the news a great deal this week. Tell our viewers about that legislation.
Well, it was perhaps the most poorly timed piece of legislation when it comes to national news. But currently, there are 22 states in the nation that provide for family planning coverage. This is just contraception services and the medical visits that are associated with contraception services to people of childbearing age below a certain poverty level. And usually it's in line with the state's Medicaid program. So in Rhode Island, that would be 250% of the federal poverty level. I really think that this program has 3 bonuses to it. One, it's a healthcare issue. It gets women into a doctor's office once a year, making sure that they are healthy, and it has you communicating with a medical professional. 2, I believe it's an anti-poverty issue because we're talking about women who are in low poverty levels. If they were to have children, that poverty cycle would be perpetuated. And so if they can have some control over the timing of their children, then their children will be healthier, their economic well-being will be healthier. But 3, and this is the real bonus point, it's actually a money savings issue.
I would think so.
It's because Medicaid funding for family planning services is funded at a 90-10 rate. 90% of the cost is funded by the federal government. Prenatal care or general Medicaid cost is funded at a 50-50 rate. So the state is spending far less money to provide contraceptive services than it would for prenatal care, labor and delivery, and a potential 19 years of health insurance for a child. States that have done this have seen millions of dollars of savings because they've implemented this preventative care. So if you're not in it for the anti-poverty realm, if you're not in it for the public health realm, I think you can buy into it in the money savings component of this legislation.
Well, and again, I think that you don't have to be Phi Beta Kappa Harvard Business School to understand that there could be a significant potential savings.
Yes.
Not to mention improving the quality of life for a lot of women in Rhode Island.
And families, for parents and for children. We know that women who have children that they aren't prepared for often don't get the proper prenatal care, may lead to premature birth, and that leads to a lot of medical expense. And so parents together, husbands and wives, partners, can make the decision about when they have children, and that's just better for the whole community.
Obviously, Speaker Fox thinks a lot of you. He selected you to represent our state at the Emerging Legislative Leaders Program in Virginia.
Yes.
How was that?
Well, it was an honor, let me tell you. I went last July, and so I was still pretty fresh in the State House, and got to meet legislators from across the nation and talk about issues about education funding and education reform, talk about just how legislators work, how legislatures work, about the differences in part-time legislatures from full-time legislatures, and really learning about how to make an impact in this system. I grew up involved in politics, and I interned for the governor when I was in college. I've been around this building a long time. I thought I knew what I was getting into, and I was elected and was stunned. And so to talk to other new legislators about just the pitfalls that they've come across, the new ideas that they've had, learning about the successes they've had was phenomenal.
Well, yeah, there's nothing wrong with bootlegging good ideas.
No, not at all.
If it worked in North Dakota,
Yep.
and they came up with a better mousetrap,
Yes.
why should, I think that, that collaborative effort is really important, to bringing some of those ideas back. Were you able to steal a couple?
So I'm still working on a couple, and I've remained in contact with legislators from Vermont and California and Virginia and New Jersey. Just recently, there was a hearing in the HEW committee about bath salts, some sort of chemical that young people are ingesting, and it is a drug kind of chemical. And we were struggling with the way the legislation was written. And I said, at that conference in July, I met a legislator from New Jersey who said that they had recently outlawed bath salts. I was able to contact her. She was able to share with me the definitions that they used, how they created the legislation, and it really allowed me to be more helpful to this body.
Yeah, and that's one problem that we need to get out in front of. Also, you've referenced your own education. The speaker also appointed you to a special House commission that's studying higher ed
Yes.
affordability here in Rhode Island. What are you finding out?
It's fascinating. We've been meeting for a little over a year, and we've heard from the college and university presidents throughout the state, through many education experts throughout the nation. But I think what was most interesting was going to Rhode Island College and the University of Rhode Island and CCRI in Newport and hearing from faculty and staff and students about their concerns for the rising cost of education in our state. It's something we really need to figure out because I went to Rhode Island College. I benefited from having education that was subsidized by the state, and now I'm giving back to the state in a variety of ways. And I think that a good higher public education system will only be successful with figuring out how we can fund it in a way that makes sure that Rhode Islanders can be educated here in a way that they can afford, and then go on to contribute to their communities later on.
Well, listen, you didn't waste any time hitting the ground running when you came here in this building as an elected official. You have to be pleased, again, in your freshman year with a piece of legislation that passed the House that would eliminate the 7-day waiting period for people that are going to get some sort of disability
Yes.
coverage. Again, that's something that must make you pretty proud. Tell our audience about that.
Yes, it was very exciting to see my own piece of legislation on the floor. So what it is working with the Department of Labor and Training, we crafted legislation that indicated that currently when folks apply for TDI, temporary disability insurance, they would have to wait 14 days to get their first check. And then at day 28 of their disability, their temporary disability, if they were still receiving TDI, then they would get that first check, that first 7-day check at day 28. It's a little confusing.
Right.
What DLT said is that 80% of people get that check anyway. And it would be easier for them administratively and for the clients to be able to get that check right away and not have that waiting period. I also saw it from another perspective. I know that many Rhode Islanders live paycheck to paycheck. I know that for many people, if you are getting a paycheck today and then something happens and now you have to wait several weeks to get another check, that could really have you spiral into crisis. Maybe you miss a mortgage payment. Maybe you can't afford your food or put gas in your car. And so by eliminating that waiting period, you've helped people who are facing a tough situation, regardless of what their disability is. If it's enough that you can't be at work, you're probably in a tough situation and not having that fiscal problem.
We're running low on time. There's a couple of
Sure.
things I want to get to. Providence.
Yes.
Can the General Assembly do more to help Providence with some of its financial problems?
I'm confident that we can. Now, the exact issues, I'm not exactly sure about. The Providence delegation does meet with the mayor and the city, and I meet regularly or speak regularly with the city council members in my district to see how we can assist them, find some ways to get some more revenue into the state to relieve the burdens that they're feeling from their high expenses. And I don't have the answer yet, but I'm confident that we will be able to find a way to help our city.
Oh, just last week we had your colleague, Representative Carnevale on, and he too was optimistic. And again, as Providence goes, so goes our state.
So true.
We have to keep our eye on that. Fenway Park is celebrating its 100th birthday this year.
I have heard that.
But you're interested in another organization that's celebrating its 100th anniversary.
Is it Oreos? Because they're turning 100 too.
Yeah, I forgot about that, but you're right. You brought a group of Girl Scouts in to the State House, and that must hold a special place for you because I understand you were once a Girl Scout yourself.
Well, I consider myself to still be a Girl Scout.
Oh, that's
in fact,
right. That's right.
Both my sisters and I were Girl Scouts for 12 years, active in troops, really learned so many things. And the best thing about the Girl Scout organization, in my opinion, is that it allows girls and young women to find what they're passionate about and pursue their dreams with confidence. My older sister was a camper. My younger sister was involved in the arts. I was always interested in government. We all pursued the things that we loved through that organization. And I was so just thrilled beyond belief that I was able to host them here at the State House.
They must have had a great time.
I think that they did.
Well, listen, I'll tell you something. You certainly have not let any grass grow under your feet in your short tenure here. You've been very, very busy. I thank you for taking time out of your schedule to join us today. Representative Maria Cimini, thank you so much for being our guest.
Thank you, Dave.
And most importantly, we couldn't do it without you. Thank you so much for tuning in. My name is Dave Barber. Remember, you heard it straight from the Gavel.